Welcome to Humanautic, unlocking the secrets inside your body and brain. How does the term makes you feel? Open heart surgery. It sounds terrifying, right? But for millions of people worldwide, this procedure is life-saving. In today's video on Humanautic, we're going to break down exactly what happens during open heart surgery, step by step, from preparation to recovery. If you love learning about human anatomy, surgeries, and diseases, don't forget to hit that subscribe button to Humanautic. Why open heart surgery? Doctors usually recommend open heart surgery when blood vessels supplying the heart are blocked, when valves don't function properly, or when part of the heart needs repair. Conditions like coronary artery disease, heart valve disease, and congenital heart defects are some of the main reasons. By the way, if you're new here, subscribe to Humanautic for more fascinating medical breakdowns every week. Preparation. Before surgery, the patient is given general anesthesia, meaning they're completely unconscious and pain-free. The chest is cleaned and sterilized. The surgical team includes a cardiac surgeon, anesthesiologist, perfusionist, and nurses, all working together. Opening the chest. The surgeon makes an incision down the center of the chest and carefully divides the breastbone, also called the sternum, to access the heart. Special retractors hold the chest open so the heart can be seen clearly. Heart-lung machine. Since the heart must be stopped for many procedures, doctors use a machine called the cardiopulmonary bypass machine, or simply, the heart-lung machine. This incredible device temporarily takes over the job of the heart and lungs, pumping blood and supplying oxygen throughout the body while the heart is being repaired. The surgery itself. Now the actual repair begins. Depending on the problem, if arteries are blocked, surgeons perform a coronary artery bypass graft, CABG, using a vein or artery from another part of the body to reroute blood flow around the blockage. If valves are damaged, they may be repaired or replaced with artificial or biological valves. In some cases, congenital defects, like holes in the heart, are patched. Every surgery is unique, but the goal is always the same: restore proper blood flow and function. If you're finding this explanation helpful, subscribe to Humanautic for more content like this. Restarting the heart. Once the repairs are done, the surgeon restarts the heart. Sometimes it begins beating on its own, and other times it needs a small electric shock. The heart-lung machine is gradually turned off, and the patient's own heart takes over again. Closing up and ICU care. The sternum is wired back together with surgical steel, the incision is closed with stitches or staples, and the patient is moved to the intensive care unit. Here, they're closely monitored for several days as the healing process begins. Open heart surgery is complex, but it's also one of the most life-saving procedures in modern medicine. Thanks to decades of innovation, survival and recovery rates are higher than ever. If you enjoyed this breakdown and want to learn more about the human body, make sure to like this video, share it, and subscribe to Humanautic. See you in the next one.